Anatomy of the cervical spine. The cervical spine is a crucial part of the human skeletal system, providing structural support, mobility, and protection for the spinal cord and associated nerves. Comprising 7 vertebrae labeled C1 to C7, it forms the uppermost portion of the vertebral column and connects the skull to the thoracic spine. The cervical spine facilitates head movement, supports posture, and plays a vital role in the nervous system. Understanding its anatomy, including the vertebrae, intervertebral discs, ligaments, muscles, nerves, and blood supply, is essential for diagnosing and treating conditions related to this region. Structure of the cervical spine. Vertebrae of the cervical spine. The cervical spine consists of 7 vertebrae, each with unique anatomical features designed for flexibility and support. The first 2 vertebrae, the atlas, C1 and axis, C2, differ significantly from the others due to their specialized roles in head movement. C1, the atlas, is the first cervical vertebra and lacks a vertebral body. It has a ring-like structure with anterior and posterior arches, supporting the skull at the atlanto-occipital joint. This joint allows for nodding movements, flexion, and extension of the head. 2. Axis. C2, the axis, is the second cervical vertebra, characterized by the dens odontoid process, a peg-like projection that fits into the atlas. The atlantoaxial joint, formed between the atlas and axis, enables rotation of the head. These vertebrae have a typical structure consisting of a vertebral body, pedicles, laminae, spinous processes, and transverse processes. They also possess transverse foramina, which allow passage of the vertebral arteries supplying blood to the brain. Intervertebral discs are fibrocartilaginous structures located between adjacent cervical vertebrae, except between C1 and C2. These discs consist of nucleus pulposus, a gel-like core that absorbs shock and distributes pressure. Annulus fibrosus, a tough outer layer of concentric fibrocartilage rings that provides structural integrity. The intervertebral discs allow flexibility and cushioning, preventing excessive stress on the vertebrae. Joints of the cervical spine. The cervical spine includes various joints that facilitate movement while maintaining stability. 1. Atlanto-occipital joint, between the occipital bone and atlas, allowing flexion and extension. 2. Atlantoaxial joint, between the atlas and axis, permitting rotation of the head. 3. Zygapophyseal, facet joints, synovial joints between the articular processes of adjacent vertebrae, enabling smooth gliding movements. 4. Intervertebral joints, formed between vertebral bodies and intervertebral discs, supporting weight-bearing and flexibility. Ligaments of the cervical spine. Ligaments provide structural support, stability, and restrict excessive motion in the cervical spine. Anterior longitudinal ligament runs along the front of the vertebral bodies, preventing hyperextension. Posterior longitudinal ligament, PLL, located on the posterior aspect of the vertebral bodies, limiting hyperflexion. Ligamentum flavum connects adjacent laminae and maintains spinal curvature. Interspinous ligaments, found between spinous processes, limiting excessive flexion. Supraspinous ligament runs along the tips of spinous processes, providing additional stability. Muscles of the cervical spine. Several muscle groups control movement and maintain posture in the cervical region. Superficial muscles. 1. Sternocleidomastoid, SCM, a paired muscle responsible for head rotation, flexion, and lateral bending. 2. Trapezius, a large triangular muscle that extends the neck and stabilizes the scapula. Deep muscles. 1. Longus colli and longus capitis, important for neck flexion and maintaining cervical spine curvature. 2. Scalene muscles, comprising the anterior, middle, and posterior scalene. They assist in neck movement and respiration. 3. Suboccipital muscles. These small muscles at the base of the skull aid in fine head movements. Blood supply to the cervical spine. The cervical spine receives blood supply from the vertebral arteries, which travel through the transverse foramina of C1, C6. These arteries form the basilar artery, supplying the brainstem and cerebellum. Additional contributions come from the thyrocervical trunk and ascending cervical artery, which nourish muscles, vertebrae, and spinal cord structures. Venous drainage occurs via the vertebral veins and the internal jugular vein, ensuring efficient circulation and preventing congestion. Functions of the cervical spine. The cervical spine performs several essential functions. 1. Supports the head. The cervical vertebrae bear the weight of the skull while allowing movement. 2. Facilitates mobility. It enables flexion, extension, lateral bending, and rotation of the head and neck. 3. Protects the spinal cord. The vertebral canal houses and safeguards the upper spinal cord. 4. Allows neural communication. Cervical nerve roots transmit signals between the brain and upper body. 5. Aids in respiration. The phrenic nerve, C3, C5, controls the diaphragm, essential for breathing. Common cervical spine disorders. Several conditions can affect the cervical spine, leading to pain, restricted mobility, or neurological impairment. 1. Cervical spondylosis, age-related degeneration causing stiffness, pain, and nerve compression. 2. Herniated disc, a bulging or ruptured intervertebral disc pressing on spinal nerves, leading to radiculopathy. 3. Cervical myelopathy, compression of the spinal cord causing weakness, coordination issues, and numbness. 4. Whiplash injury, sudden hyperextension and hyperflexion of the neck, common in car accidents. 5. Cervical stenosis, narrowing of the spinal canal, leading to nerve compression and pain. Early diagnosis and appropriate treatment, including physical therapy, medications, or surgery, are essential for managing these conditions. The cervical spine is a complex and essential structure responsible for head support, mobility, and spinal cord protection. Its intricate anatomy includes 7 vertebrae, intervertebral discs, ligaments, muscles, nerves, and blood vessels, all working together to maintain function and stability. Understanding its components and potential disorders allows for effective diagnosis and treatment, ensuring optimal spinal health. Proper posture, strengthening exercises, and medical intervention when necessary can help maintain the cervical spine's integrity, preventing injuries and long-term complications.